Every cardiologist knows something most of us over 60 have never been told. The snack sitting in your kitchen right now could be quietly working against your heart. Your arteries are not the same at 65 as they were at 40. They are stiffer, less forgiving, and far more sensitive to inflammation. What felt harmless a decade ago can now tip the balance toward a heart attack or a stroke. And nuts, which most people assume are always healthy, are where this gets complicated fast. By the end of this video, you will know exactly which 4 nuts to put down and which 4 to reach for instead. Stay for number 3. It is the one most people are eating every single day without realizing the damage it is quietly doing. Here's the one that surprises people the most. Cashews feel light and harmless, but for anyone managing blood sugar after 60, they carry a hidden cost. Cashews rank higher on the glycemic index than nearly every other nut, and a single small handful can send blood sugar spiking in ways that strain the heart. Research published in the journal Nutrients found that repeated blood sugar spikes over time are directly linked to accelerated arterial damage, the kind that raises your risk of heart disease even if your cholesterol looks fine. If you enjoy cashews, limit yourself to 8 or 10 at a time and pair them with a protein. And if you are pre-diabetic or diabetic, speak with your doctor before keeping them in your regular rotation. It is a small adjustment that can make a real difference. But here's something that will genuinely surprise you about what you should be eating instead, and it costs almost nothing. If a nut has been sitting in a gas station display jar for 6 months, the problem is not just freshness. Honey roasted peanuts and heavily salted mixed nuts are where heart health quietly unravels. The sodium in a single serving of salted mixed nuts can exceed 200 milligrams. And most people do not stop at one serving. A study from Harvard followed over 70,000 adults and found that high sodium intake in people over 60 was one of the strongest predictors of elevated blood pressure and cardiovascular events. The real danger is not the nuts themselves, it is the processing. Your heart does not care that the label says nuts. It cares about what was added to them. If you grab nuts from a bag, the label should say one thing: the nut, nothing else. If that one hit close to home, number 3 is the one you really need to hear, because almost everyone in this age group is making this exact mistake. A moment for those of you watching this right now who have been doing your best to eat healthy. This is not about blame. This information simply was not out there. Now it is. And that changes everything. Pecans are genuinely heart healthy still, but candied pecans, the kind that show up at holiday tables and in trail mixes, are a different food entirely. The sugar coating caramelizes in a way that concentrates both calories and simple sugars in every bite. Research from the American Journal of Clinical Nutrition found that added sugar intake in seniors was more closely linked to cardiac inflammation than saturated fat, a finding that contradicts decades of older dietary advice. If you love pecans, eat them raw or dry roasted with nothing added. The nut itself is one of the best things you can put in your body after 60. The coating is the problem. If you find this kind of content useful, the kind that goes deeper than just a list, tap the subscribe button. This channel exists specifically to give people in your age group the real information, not the simplified version. Brazil nuts are the strange one. 1 or 2 a day is genuinely protective for the heart and thyroid, but Brazil nuts are the single highest dietary source of selenium on the planet, and selenium is one of the few nutrients where the difference between therapeutic and toxic is just a handful of nuts. Research from the National Institutes of Health warns that chronic selenium excess can lead to heart arrhythmias and nerve damage. This is not a reason to avoid Brazil nuts. It is a reason to count them. 2 is a dose, 6 is a risk. Keep them to 1 or 2 daily and you will get real benefits. Eat them like popcorn and you will not. Now, here's where this gets genuinely hopeful. The 4 that protect your heart are remarkable. Walnuts. If there is one nut backed by more cardiac research than any other, it is this one. Walnuts are the only nut with a significant amount of plant-based omega-3 fatty acids, the kind that reduce arterial inflammation directly. A landmark study from the American Heart Association found that eating a small handful of walnuts daily reduced LDL cholesterol by up to 10% in adults over 60 without any other dietary changes. 7 whole walnuts per day is the research-backed amount. They are better eaten in the morning when your body can use that anti-inflammatory effect throughout the day. Raw or lightly toasted, nothing added. Your arteries will feel the difference within weeks. Almonds come next, and the research on these is specific to what happens inside aging arteries. Almonds are rich in vitamin E and magnesium, 2 nutrients that drop sharply after 60 and are directly tied to blood vessel elasticity. A study in the Journal of the American Heart Association found that daily almond consumption significantly reduced non-HDL cholesterol, the kind most associated with plaque buildup, in adults over 55. 23 almonds is 1 serving. Eat them raw. Blanched almonds lose some of their vitamin E content, and roasted in oil almonds add calories without adding protection. You're more than halfway through, and what you have already learned could genuinely protect your heart for years to come. The next 2 are the ones most seniors are not eating enough of, and the difference shows up in your blood work. Pistachios are the underdog of cardiac protection. People overlook them because they seem like a snack food, but pistachios contain more potassium per serving than almost any other nut, and potassium is the mineral most directly responsible for keeping blood pressure in a healthy range after 60. Research from Penn State University found that 2 servings of pistachios daily lowered systolic blood pressure significantly in adults who were already at elevated risk. 49 pistachios is 1 serving. Buy them unsalted in the shell. Shelling them slows you down, which naturally controls how many you eat. And the shells give you a visual count of how much you have had. And finally, hazelnuts, the most underestimated nut on this list. Hazelnuts are exceptionally rich in folate, a B vitamin that helps lower homocysteine, an amino acid that, when elevated, is a strong, independent predictor of heart attack and stroke in people over 60. A study in the European Journal of Nutrition found that regular hazelnut consumption meaningfully reduced homocysteine levels in older adults within just 8 weeks. 20 whole hazelnuts per day is what the research supports. Buy them raw, not the chocolate-covered variety, and keep them in the refrigerator to preserve freshness. Thank you for staying with this all the way through. What you now know about which nuts are quietly working against your heart and which ones are genuinely protecting it is the kind of information that can shift things in a real way. Please share this with someone you love, a spouse, a sibling, a friend who is trying to take care of their health. Sharing it is one of the kindest things you can do for them. And as always, talk to your doctor before making significant changes. They know your full picture in a way no video ever can.